Hello everyone. Today I want to talk about the case study for Louisiana mass immunization exercise. So first I want to talk about 1 second, sorry. So the introduction. So what is the immunization vaccine that we actually looking for? And right now in the United States, in 2017, they were doing 33 vaccine for the human disease, and then also that will be produced through our 9 manufacturers. But the most biggest and also important that the highest or the larger capacity that the company that we can do it, that is a centralized pastures where they are produce so many vaccine for the human disease. But they also because only one manufacturers, but that's why they're little limited of the number of the vaccine in the United States. So that's we need to go somewhere else or anything to produce the vaccine for during pandemics as well. So what is the goal and the purpose on these articles or this exercise? The goal is vaccine goal that will be obviously is during the pandemic, we also want to make sure everyone be staying healthy and everyone have vaccine or medication in order to or stopping the spread. So the goal of the vaccine one is to establish and manage the dynamic of the pandemic influenza vaccine, so which is that to prevent that anyone they can able to have it. And then for vaccine goal 2, that is going to be provide a pandemic vaccine, which is the vaccine that it can curse the flus, and then also like getting also one of the things is they stop spreading as well. And so for that goal, we also go into the two antiviral that is also helping during the pandemic, so which is the provide the influenza antiviral drug for treatment during the pandemic illness, and then also the strategy limited the like onset of the pandemic. So after the pandemic or during the pandemic, like how the vaccine, the antiviral that can able to like getting more. So for example, like if you have any method, any um, procedures that always help to during the pandemics and after pandemic, how we can like prevent that it's gonna coming back again. So diagnosis goal for this article will be developing the new technology for laboratory points of care. So that's how we're gonna be giving out what is the procedure for the safety as well. So the purpose is just to control the number of the spread. So as we already know that this article we're talking about H5N1, but as of the real time right now is going to be COVID. So that's how this one is might be also going to be applying it to not for in general as because this one is more about influenza, but this one is also control the spread so that we can able to relate it to the COVID-19. So what is the solution is here? So they are providing the immunization register, so that is going to be make sure every single citizen, every single person living in the United States, they always need to have a vaccine or follow up with like how many vaccine they have or vaccine to curve to spread or to stop, like to not to spread, I'm sorry, just to prevent the virus that's go into immune system. So as of now, 49 out of the 50 states implement the state registry. So where we actually going to be target to. So mostly is for adult nursing homes or any of the children stay school. So if you want to go to school, you need to have those kind of vaccine in order to submit to school, or any of like school for university or any. That's why they have a requirement to any apply for any school or apply to any work related to healthcare. We need the immunization form, which is going to be asking us how many shot of vaccine, how many vaccine that we already been getting. So in Louisiana, for this case, they are actually provide many of the solution, which is they open the statewide influenza vaccine event, which is provide more real-time information. They want to make sure every single person or every single resident will be able to getting note about the vaccine and also able to have a vaccine. And then also they also focus on the immunization network for kids statewide, which is shortcut is link, and yet utilize the electronic immunization records, where is we can actually track down who and how and like how many and where that this the person that they're not able to getting the vaccine yet, and they will be getting that as well. And then the achievement for this actually for the solution and for the procedure that they are aiming for, that is in 2005 and 2006, they increased the paperless of the public's health response to emergency, and then also the data is more valuable and efficiency, not only just a paper form wide, but they also doing the electronic data collection, which is really helpful for all like time consumer can be reduced, and also all the paperwork can be also stored in the secure and on air easy to transfer rather than just a whole bunch of papers form and stuff. And continue, and they also still continue and improve the electronic system capacity, which is not only just the data but also equipment or any like the vaccine why they also want to make sure everything will be updated. And then that's where they are eliminate the errors and also paper form, so everything will be now most of percent, like I would say most of them will be backup of the online system. And then also help to consolidate the views, and also make sure the details, and also able to check down all the database as an emergency level, so there's no postpones or anything. And also there's more easy to help professionals or any of the team member to get more of the real-time information. So as after this article, I will say they are addressing to all the goal is appropriately, uh, and then also the achievement that they are able to getting into the data real time. But in another hand, that is they still need to work on more of like getting the real data real times, and also the vaccine why, in order so they can hit in the goal number 1 and goal number 2, because they already able to do antiviral 1, antiviral 2, and then diagnostic they are working on that, but the main focus is more goal 1 and 2 for them to actually able to provide all the vaccine for the during the pandemic as well. And that's all for me today. And then if you have any questions, please feel free to ask. And this is the citation that I using reading this article through the book, and then for me to able to get all the information as well. Thank you for listening, and have a good night. Bye bye.